Good afternoon, everyone. I'm London Breed. I'm mayor of San Francisco, and today we are joined by the Department of Emergency Management Director Mary Ellen Carroll, as well as the Department of Public Health Director Dr. Grant Koufax. We are also joined by members of law enforcement, including our Police Chief Bill Scott, as well as our Sheriff Paul Miyamoto. And also the Director of Homelessness and Housing Services, Abigail Stewart-Kahn. Today, we want to just provide a few updates of where we are and some very serious challenges that we face. So far, as of today, we have confirmed 797 cases. And sadly, 13 people have lost their lives due to the virus, the COVID-19 virus. And we have said all along that this would be very challenging. And in fact, in the past week or so, Dr. Koufax and I continued to make it clear that it is, of course, important to stay at home as much as possible. Because the fact is the worst is yet to come. And today, unfortunately, we have a situation that we knew could potentially happen in one of our congregate living settings. An outbreak has occurred in MSC South, one of our shelters. And the real challenging situation that we know could have been worse will be a little bit better because of the work that we were preparing to do in order to make sure that we were able to respond quickly. Today, we want to announce that we have identified 70 people, 68 members of the shelter, as well as 2 staff members who have tested positive for COVID-19. This is one of the largest shelters in San Francisco. With anywhere on any given night over 340 people that are located in that shelter. Part of acquiring hotel rooms and thinning out our shelters has truly helped in this particular case because as of last night, there were only 100 residents in the shelter, which has provided us with the flexibility to turn this from a shelter to actually a medical facility. And so Dr. Koufax will talk more about what that means. But the fact is, we were on top of it. We know that there are a number of people who have tested positive, and we are going to reroute our medical health experts and people, our nurses and other health support to this facility to help manage and maintain and support the people who have tested positive. The reason why we are able to act fast is, number one, we had hotel rooms available, and we had plans to staff up hotel rooms as rapidly as we possibly can in case an outbreak occurred. But number two, because so many of you are staying at home, our hospitals are not as overwhelmed as they could be, giving us the flexibility to handle an outbreak of this nature. We know that from the very, very beginning, congregate living settings, like our shelters, like Laguna Hospital, like our single-room occupancy hotels, we knew that those had the potential of being hotspots. And so we have been preparing for that. We have been preparing for that by acquiring a number of hotel rooms, making sure that we have the supportive service necessary, making sure that we can keep the people that we are asking to work at these hotels safe, making sure that we can feed people, that we can clean the rooms, that we can do the laundry, that we can do all that it takes to manage the situation in any place that we acquire under the new orders that we've put forward to obtain as many hotel rooms as possible. So although the news of this outbreak was definitely very troubling, the fact is I am so grateful and proud of this hard working city workforce, from the Department of Public Health to the Department of Human Services to the Department of Housing and Homeless Services, the folks who work for these departments who are showing up, putting their lives on the line and working every single day with the nonprofit providers who help to manage these hotel rooms, they are the ones who are on the front lines trying to make sure that they not only protect themselves, but they want to make sure that they protect others. And so we were prepared for this. We are managing the situation, and Dr. Koufax will provide more information as to what is happening at this particular facility and where we go from here. I want to also talk a little bit about another very troubling situation that we know exists. And because so many people are being asked to shelter at home, we know that sadly, some people who are sheltering at home may not be in safe environments. We know that domestic violence doesn't stop because of a pandemic, and it is important that we continue to provide support, we continue to provide services so that we can help the people who we know need it the most. And I know that so many domestic violence survivors out there are probably, thinking about what we are doing as a city to protect others who have not been able to escape those very challenging situations. And I am grateful to Partners Ending Domestic Abuse and so many of the folks who work tirelessly on helping to end domestic violence and the work that they have continued to do. They have sadly seen an uptick in the number of calls that they receive for help, for assistance, for their shelters. And as a result, we teamed up with the District Attorney, Chesa Bodine, and Veritas, a property owner here in San Francisco, to provide 20 new units that are fully furnished so that when we need to get people out of a situation, we can move quickly. So I want to thank Veritas and I want to thank our District Attorney, Chesa Bodine, for working with us to recognize this very serious issue and reacting quickly to provide resources in addition to the shelters and the other support that we have been able to work with nonprofit providers to provide to families who are experiencing domestic violence. But we know it's not just about making sure we have places for people to stay. If you're in a situation at home and you can't pick up the phone and call 911, what do? It's hard enough feeling like you're trapped and you can't escape. And what we have been able to do here in San Francisco, and I am so, again, grateful to the Department of Emergency Management and the dedicated people who work for this city, who have been able to program our system in our city so that if you text 911, and you say help, or you're able to say what the situation is, and you're in trouble or what have you, you will receive a response. And I think this is an incredible tool because, again, we know that if there is an attack or if there's something going on and you can't necessarily talk out loud or what have you, it is definitely difficult in order to reach out for help. So to anyone who might be hearing impaired or others in our communities who are struggling and may be attacked or may need 911, now here in San Francisco, the option to text 911 is available. And so especially at such a really challenging time for all of us, we know that having access to support to safety is critical to being able to survive this pandemic. And so again, thank you so much to Mary Ellen Carroll and the Department of Emergency Management. I also want to say to those who are looking for help and support, we are here for you. You are not alone, and we will do everything we can to support and protect you during this pandemic. If you need help or you need assistance, please call or text 911. If you need someone to talk to or you're looking for resources, you can call 311 and we can direct you to some services, including the National Domestic Violence Hotline, as well as La Casa de las Madres. Amazing organizations that continue to uplift and help those who are not only in domestic violence situations, but also survivors. So thank you so much for your work on helping those who are struggling during this pandemic. We also want to talk a little bit about what's happening with our restaurants here in the city. Some of you during when we weren't in a pandemic, many people, including myself, used a lot of apps to get food delivered. And after we had to unfortunately close restaurants and basically not allow them to have in-house dining, we still allowed pickup and delivery, and some restaurants chose to close because sadly, it was too expensive to even have that level of service. And others who are struggling even now with their delivery and pickup service, they're still in business, but the fees, and in some cases, very outrageous fees that are charged to them, basically, in some cases, may not allow for them to continue with their delivery services because they're not even breaking even in some cases. And so, unfortunately, with the delivery services, there is a fee that's assessed. Sometimes there's free delivery, as you see on those apps, but the restaurant is still charged a specific fee as it relates to the delivery service, which usually happens with a third party. And we have seen those fees basically go up and down. The restaurants have experienced it, and it has been hard. They want to remain open for all of you. They want to be available for all of you, but they are struggling because the delivery costs are making it unsustainable. And so that's why, after working with the Golden Gate Restaurant Association and carefully evaluating the situation, I've decided to execute an emergency ordinance to cap the amount of fees that a third party can charge to restaurants for delivery services at 15%. And what this will do is to make sure that our restaurants are protected because we know during this pandemic, which we are not certain as to how long it will last, there are going to be a lot of restaurants who may not come back from this. And we want to make sure that when we identify a situation that's problematic, we address the situation. And the goal here is to address the situation with putting a cap on the amount of the percentage of which the third-party delivery entities could charge restaurants for delivery service. And I want to thank the Golden Gate Restaurant Association, and I also want to thank Supervisors Asha Safai and Supervisor Aaron Peskin for working with my office on coming up with something that would be fair and more helpful to our restaurant community. So I also want to take this opportunity to talk about just, again, the importance of staying at home. Now, I know, having these conversations here every time there's a press conference, it reminds me of my grandmother, and oftentimes because, sometimes I was a difficult kid to discipline, and my grandmother would say to me over and over again, no, you can't have that. No, you can't have that. Or no, you can't go outside. No, you can't go outside. And I would say, please, Mama, please, can I go outside? And my grandmother would just say, no, for whatever reason. And she had to tell me that over and over again sometimes. And eventually, I gave up or she gave up, who knows. But the fact is, you're hearing this beating drum from me, from so many other people. We're asking you to stay inside, to stay inside, to stay inside. And I know that it's hard. I know that so many of you are getting restless and getting frustrated and wondering when it would come to an end and really what difference it does make. And let me just go back to what I said earlier about our shelter system. The fact is, because so many of you are socially distancing yourself from one another, what's happening is you're not getting infected, you're not showing up at our hospitals. We've seen, a slight reduction in the number of people who are occupying our beds. And even though we know the numbers will continue to go up, even though we know this outbreak at one of our shelters has been challenging, the fact is, because of what you are doing, we are able to move quickly to address an outbreak. Because of what you're doing, we're able to redeploy medical health professionals to one of our shelter systems in order to provide the resources necessary to take care of those 70 people that have been infected. Because you are staying at home, you are making a difference. And when you look at other places all over the world, I'm sure you've seen some of the videos of the hospitals in New York. You've seen the videos of some of the hospitals in Italy. You've seen some of the videos of people who can't bury their family members. Just think about it. Because you are following the order, you are making a difference for others in this city. So I just want to ask you again, especially because we know that the weather is going to be really nice this weekend. We know that it's so tempting, especially because it's also Easter. Today is Good Friday. It's Easter. It's a very spiritual time for so many people who are religious. And folks are probably thinking, just this one time, I miss my friends. I miss my family members. I want to have dinner together. I just want to sit down and enjoy their company. And as hard as it is to be isolated in your home, I'm going to ask just one more time that you don't tempt yourself, you don't do it this one time, because that one time could be problematic. I saw on the news this past week a family that got together for a birthday party for one of their family members, and now all of them are infected. They don't know how, they don't know where it came from, but the fact is they're all infected. We all heard about the choir in Washington State. They practiced social distancing at choir rehearsal. The order was already in place there, and 45 members were infected and 2 died. And so as hard as it is to stay at home, to continue life in a way that's not normal for us, it's necessary. It does make a difference. It does save lives. And some of the things that you can continue to do is, call people. You can Zoom call with folks if you have that level of technology. And you can just reach out and check on folks. I also talked about the note I got from a neighbor with their email and their phone number asking if I needed any errands to be run or just someone to talk to. That's going to be critical to getting through this, is how, and social distancing is probably not the best term developed to talk about this. It's really about physically distancing ourselves. It's important that we physically distance ourselves, but we continue to engage with one another. We continue to reach out to one another for help, for support, or what have you. So as we go into the weekend, we are going to be watching closely and monitoring our parks. We're going to be monitoring various locations where we know large groups of people gather. And I hope that we won't be forced to close any parks or make any adjustments because people are not following the order. We want you to get fresh air. We want you to get outdoor exercise in whatever way you feel is appropriate. We want you to walk your dog. We want you to be able to do some of the basic things of grocery shopping and what have you. But as you do those errands, make sure that you keep your distance from others that are not a part of your household. Make sure that after you are done, you go home. Make sure that you're not driving to locations that aren't near where you live, because that creates a bigger problem than what we want to happen in our city. And then it forces us to make adjustments in order to keep you safe. And I want people to have the ability to just go outside and get some fresh air. And because so many of you have cooperated with this order, we are here. And as I said, as we go into Easter Sunday, I want to again thank folks from the Interfaith Council. Michael Pappas was here on Wednesday, and I continue to be grateful for your prayers and your support during this difficult time. So many people who are spiritual are really not only struggling themselves, but so many are reaching out and praying for others. And this is definitely a time to just, remind us of how challenging it has been with so many folks who are part of our community, but also the acts of kindness, the acts of love, the things that people in this city have continued to do to just really amaze me and others has been truly tremendous. And we want to thank you all again for just being good neighbors, being good citizens of the city, continuing to put out positive messages and hope and inspiration. We need it now more than ever. And yes, we are in this together, which is why we will get through this together. And with that, I'd like to take this opportunity to introduce the Director of the Department of Public Health, Dr. Grant Koufax.
Good afternoon. I'm Dr. Grant Koufax, Director of Health for the City of San Francisco. Thank you, Mayor Breed. I'd like to start by thanking everyone in San Francisco for your cooperation, your sacrifices, and your community spirit. As we join together, we are helping fight the spread of the coronavirus. When you stay home, when you keep 6 feet apart, when you wash your hands, and when you cover your nose and mouth when you cough, you are literally saving lives every day. Today, I would like to update San Franciscans on a few developments in our ongoing work to respond to the coronavirus and to protect our community. Today's data tracker shows there are 797 San Francisco residents with confirmed cases of coronavirus. Sadly, 13 San Franciscans have died of the disease. My condolences to their families and loved ones. There are 88 patients reported in the hospitals across San Francisco with coronavirus, and approximately 1/3 of those are in the intensive care unit. Our hospitalization numbers have been holding relatively steady over the past few days, which is positive and good news. But, and I emphasize but, that number could change at any time. Please stay at home and do your part to keep these numbers steady. At this time, our San Francisco hospital system has enough beds to care for all of our current coronavirus patients, as well as patients who are hospitalized for other reasons. We continue to make progress expanding hospital bed capacity for an expected surge of coronavirus patients. the worst is still yet to come. And sadly, as the mayor mentioned, we have troubling news to report with regard to an outbreak. Tomorrow's case numbers of coronavirus will be significantly higher once we factor in new test results from the MSC South shelter. On Sunday, we confirmed that 2 guests of MSC South, San Francisco's largest homeless shelter, had tested positive for COVID-19 and were moved into isolation hotels where they are in good condition. With those first steps, my department took immediate action to conduct contact investigations and test people who were close contacts, showing symptoms or at-risk exposure. As the test results started to come back and we saw the extent of the spread, we moved on Wednesday to test all guests and staff at the shelter. On Wednesday, there were 5 positive cases at MSC South. Today, there are 70. There are currently 71 test results that are negative, and 3 results are still pending. We have always known that from the data that this virus can take off quickly, and we are prepared to provide aggressive responses, especially in congregate settings and high-risk populations. From the beginning, an area of concern, and from the beginning of our response, a prioritized population. Unfortunately, the moment is now upon us. I would like to assure San Franciscans that this outbreak does not mean there is significantly greater risk to the general public. However, it is a very serious matter. Though not unexpected, we are very concerned about the health of the people at MSC South. Many of them have chronic health conditions and are vulnerable to getting very sick or even dying from coronavirus. We are doing everything we can for them and to reduce the size of the outbreak. We have taken and will continue to take aggressive action to preserve health and safety. Every step of the way, the Department of Public Health has been working closely with the Department of Homelessness and Supportive Housing and with the operator of MSC South, the St. Vincent de Paul Society, to follow our congregate setting protocols, cleaning and disinfecting the shelter, screening and testing residents and staff, and conducting an investigation to identify close contacts of the people who tested positive. These efforts continue and are intensifying as the situation changes. Currently, my department is conducting a mass testing strategy at MSC South, testing all guests and staff for COVID-19, whether they are showing symptoms or not. Again, as of this morning, DPH had tested 144 guests and staff. Of these, 68 guests and two staff have tested positive for COVID-19. At this point, none of these people are seriously ill. One former guest of the shelter is in the hospital. We are now converting MSC South into a medical facility to care for people who are living with coronavirus. This new recovery center will be staffed by the Department of Public Health's nurses and doctors, experts, who will provide care, monitor patients, and arrange transport to hospitals if their conditions worsen. This solution has been part of our emergency planning scenarios from the beginning and is the best one to preserve the health and safety of the shelter community. It will reduce transports and collate patients with a dedicated staff of healthcare professionals who can attend their needs. Staff members who have tested positive are being offered places in isolation hotels if they do not have a safe alternative in their own homes. This offering of hotel rooms will continue for staff who test positive at this and other shelters across the city. Other guests are being moved out to hotels as well. On a case-by-case basis, depending on the guest's condition and exposure, we are working with our partner agencies to place each person in an appropriate setting, whether it's an isolation or quarantine site or a shelter-in-place hotel. This is a 24-hour, round-the-clock operation, and the situation and numbers are changing. The Department of Homelessness and Supportive Housing and the Human Service Agency are leading the effort to move guests out of MFC South, while the Department of Public Health will continue to focus on providing excellent, expert medical care, testing, and contact tracing. Now, I would like to take a few minutes to talk about equity, specifically health equity, and how it relates to the coronavirus pandemic. As we prepare our hospitals and our city healthcare system to care for our patients, we are closely examining neighborhoods and community members that may need more access to care in this rapidly changing and evolving situation. That is one of the reasons why we opened our first field care clinic this week in the Bayview. We have also opened screening and testing sites in the Castro Mission neighborhood and the Zuckerberg San Francisco General Hospital in the heart of the Mission and Potrero Hill. We know that the health disparities and economic inequalities in our community are only made worse, unfortunately, only made worse by this pandemic. Global and national data are already showing the disproportionate impact of the coronavirus on communities of color. In San Francisco, we are seeing and expect to continue to see these inequities as well. Although our current case data does not reflect major disparities yet, that data are also incomplete since we do not receive ethnic or race information for about a third of the test results that are reported to us. However, we have seen situations in the Latinx community where people who live in multifamily or multi-generational homes are unable to self-isolate. We have seen people in those same households who must leave home to work and who have to make several trips a week to buy food or other essential supplies in small amounts due to their income stream. People in such circumstances are going to be more at risk. And we are being responsive to those needs to help mitigate those risks. We have been working with leaders in the Latinx community to ensure that people have the information they need, that they are aware of the available resources, that San Francisco is a sanctuary city where everyone will receive the best care possible, regardless of immigration status, and that people continue to receive outreach in their own language in a culturally appropriate way. Leading our city's equity efforts, Director Cheryl Davis of the San Francisco Human Rights Commission has established community roundtable weekly meetings. The roundtable is a dynamic group of community stakeholders who elevate concerns about the city's response and communication with communities of color, low-income people, and the LGBTQI community, specifically around COVID-19. I would like to thank Director Davis for her leadership. With this collaboration, we can and are taking action on issues based on community input and practices. Some of these issues include food insecurity, discrimination, appropriate culturally focused outreach, financial resources, and improved communication and support. San Francisco is also one of the few counties in the country that has an equity officer and team embedded in its Emergency Operations Center. The goal of this team is to mitigate inequities in the citywide response to coronavirus for our communities of concern, including Latinx, Black, African American, Asian Pacific Islander, and LGBTQI communities. We will continue to listen to community partners, improve our response, and continue to use data to guide decisions. I am committed to the health and well-being of San Franciscans and to doing everything we can to support health and ensure full recovery for all communities in our city during and after this pandemic. Now, I would like to provide a brief update on the outbreak at Laguna Hospital and the steps we are taking to protect the health of residents and staff. We have 17 confirmed cases of coronavirus at Laguna Hospital. 13 of the confirmed cases are among staff, and 4 are among residents. Of the staff, 10 have been in patient care positions, and 3 have not. All four positive resident cases are in the South 5 neighborhood. Testing of that neighborhood is currently complete. We have also completed testing of 4 South residents, and I'm happy to say at this time we have not detected an additional case. Overall, to date, 301 Laguna Hospital staff have been tested, either by the health department or by their own provider, and 208 residents have been tested. As part of our ongoing response, we continue to test staff and patients throughout the hospital that had been identified as being exposed through contact investigation or have other risk factors, including showing symptoms of the virus. Unfortunately, we do expect more positive cases, but it is crucial that we know the facts so that we can continue to take evidence-based informed action to preserve the health and mitigate the spread of the virus in the institution. We continue to work with the CDC experts on the ground to reinforce and inform our aggressive response. As we continue to fight the coronavirus pandemic, I would like to remind you that our top priorities continue to be reducing the spread of the virus in the community, flattening the curve through the physical distancing that we are continuing to enforce and ask you to do, protecting vulnerable populations, healthcare workers, and first responders, preparing our healthcare system for the expected surge of hospital patients, and expanding our testing capabilities. In all of this work, we seek to continually do better as we incorporate the latest science, data, and facts into our actions and recommendations. We are working quickly to integrate new information all the time and adjust our recommendations accordingly so that we are providing the very best, most up-to-date advice to you, to the community that we can. Thank you. And Director Abigail Stewart-Kahn, Director of Homelessness and Supportive Housing, will now provide remarks.
Hello. The city and our nonprofit partners are battling 2 simultaneous health emergencies. the ongoing crisis of homelessness, and the compounding issue of COVID-19 pandemic. This has taught us time and time again that everyone's health is intertwined, the homeless and the housed. Protecting the health of people experiencing homelessness is essential to safeguard their health and all of our health. Therefore, we must focus not only on improving the health and safety of our shelters and programs, but also moving people to safety as quickly as possible. When people do not have homes to reside in and reside instead in public places and congregate shelters, they have high exposure to this virus. People experiencing homelessness have limited access to the recommended preventative measures, including hand washing, home isolation, avoiding high-touch services, and rapid access to health care. People who are homeless and unsheltered are far more likely to have chronic underlying health conditions, making them even more vulnerable. The city has taken many proactive steps to improve the health and safety of people experiencing homelessness. Today, I want to focus, as Dr. Koufax did, on MSC South. Thank you to our staff at HSH, our provider, St. Vincent de Paul, and all of our incredible city partners who, under the mayor's leadership, have wrapped their arms around this site, its guests, and its staff. For the last many days, we have been working on this, both preventatively and since we had our first positive test. This is a large shelter with 340 bed capacity and a 70-person drop-in center. Due to our early and rapid actions to limit the spread of COVID by pausing shelter intakes, we reduced the census to approximately 175 people. Before and since our first positive test at this site, we've moved over 70 people out and now have a census of approximately 100. Our partners' staff are focused on this site 24/7. As you've heard, it is now a medical shelter. We are also moving vulnerable people from other congregate sites rapidly and have been for the past several days, and ahead of positive tests. We are deploying the plan we have created. And while this virus is dangerous, we are working urgently and taking all the necessary steps. I also want to provide you an update on our first COVID positive test at a family shelter. This one is operated by Hamilton Families. The same plan that has been in place for Division Circle and for MSC South is in effect with this site. The individual who has the positive test is in good condition and is off-site already. Our thoughts are with Division Circle, MSC South, and Hamilton, and our gratitude is with every San Franciscan today. Thank you.
Good afternoon. I want to start by first thanking Mayor Breed, her team, the team of our district attorney, Chesa Bodine, and Mary Ellen Carroll and her team at the Department of Emergency Management for allowing us to have the resources to help our domestic violence victims. We think the text 911 will be a game changer and will enhance public safety in our city. So I really want to thank and applaud the mayor and Director Carroll and our district attorney for making that happen. It's critical for our city to be able to provide a lifeline for those who are distressed but can't call 911. Often those individuals may be people who aren't in a safe place who can directly call 911. So this resource is a game changer. Our city's public safety dispatchers at the Department of Emergency Management do a fantastic job every day under very stressful situations, and they do their best to dispatch our police officers to calls, particularly domestic violence calls of violence, because we know how critical those situations can be, and time is of the essence. So we're very thankful for them, and we're very thankful for the partnership. We also want to thank the people that made this come together, because we think that the Text 911 service will provide another important way for people who need to reach out for help, and it will enable our officers to effectively respond to those calls for help. So whether you use Text 911 or call 911 directly, we want you to know that our city emergency responders will be there for you and be ready to respond. I want to emphasize, though, that calling 911 is always the best course of action if it is safe for you to do so. But if you can't, you can use the new Text 911 feature. Next, I want to talk about enforcement over the Easter weekend, or rather than enforcement, let me frame that in the context of compliance. Because the good news is, as the mayor has said, and as Dr. Koufax has said, that by and large, San Franciscans are complying with our public health orders, and that's really good news. But we need to keep it going. We need to keep the momentum. We are not out of the woods yet. We listen, and please listen to the public health officials. We need to keep this going. So this weekend, what you can expect to see from the San Francisco Police Department, you will see us out. You will see us in the parks with park rangers. You will see us in the business corridors in your residential communities. And we're going to continue to spread the message of social distancing. And as I've said in other conferences, news conferences, for those that have been warned, we are making a record of that, and we will not warn you twice. To date, we've had 53 notifications, and a number of those have been non-essential businesses that have been shut down. We do go back and recheck to make sure that those businesses stay closed when they are supposed to be closed. And to date, we have not had an issue with businesses reopening. We're still at 2 citations. We have not issued any citations since the first 2. And again, I want to reemphasize what Mayor Breed said. Please, this is going to be a Easter weekend where people are used to having family gatherings, attending religious services, being around people, going to restaurants, and really socializing. And we know it's hard. And this is a change for all of us, believe me. But we need to adhere to the public health orders. This is a matter of life and death. So please be with us on this. Please comply, and let's all make San Francisco a safe city. We are grateful that we've had a number, and as the mayor said, a number of our religious leaders that have supported this effort. And as the mayor said, Mr. Michael Pappas from the Interfaith Council and many others are very supportive. And I know this weekend is a religious holiday, and that's very difficult for people. But again, the religious leaders are behind us. They understand what's at stake here, and we're asking that everybody please comply and don't leave your homes if you don't have to. Shelter in place throughout this weekend. As far as crime, we are still seeing downward trends in our crime statistics. There's really nothing new to report from our last press conference. We are still down 31% in crime, which is 165 fewer than the previous week. I want to emphasize, though, that we have had some burglaries in business areas, and we are going to be in those areas to do whatever we can to make sure that our business owners aren't victimized as a result of having to close their businesses and in some cases board up their businesses. So we will be out there in force this weekend and throughout the duration of this pandemic. As always, we ask you to call 911 if you see crimes occurring, particularly violent crimes. If they are crimes that have already occurred or property crimes that are non-threatening, where nobody's safety is at risk, we ask that you call our non-emergency line at 415-553-0123. You can also call 311 or utilize our website to file police reports. And we are taking reports that we, in the past, have not taken online. We do have a call center to enable people to make reports over the phone. The last thing I want to reemphasize are the scams that are out there. When you heard from me a few days ago, I talked about the scams that are out there that we're hearing about, and I want to reiterate that there are people out there that will take advantage and are taking advantage of this situation. Now, fortunately, in San Francisco, we don't have any documented cases of people pretending to be Department of Public Health workers or Center for Disease Control workers and going in people's houses, but this is what we're hearing from both social media and in other places. Do not let people of this nature into your homes. If somebody asks to come in your home to either inspect or to give away masks or anything of that nature, they are not legitimate. We are not doing residential inspections at people's houses. Now, you will see our disaster service workers passing out flyers and informational pamphlets, door hangers and the likes on businesses, but they're doing that on doorknobs and not asking to come in anyone's home. So if you have that to happen, please call 911 because it probably is a scam and we will respond to those type of calls. Information is key and we want to make sure that the public is informed, but that information and that distribution of information does not include us asking to come into your home. With any scam, if it sounds too good to be true, it probably is. So for those people that are offering something that sounds too good to be true, please get a second opinion, investigate it before you act. Don't carry large sums of money. We have seen a couple of home invasion robberies. Please don't have large sums of money that you're carrying around or storing in your house. We ask that you use your financial institutions for that. And don't open your doors for people that you don't know. It's as simple as that. Use simple, basic safety precautions to keep yourself safe. The last thing we need is for people with all the anxiety of this public health pandemic to be worried about their safety. So use good, sound safety practices and good common sense, and don't open your doors for people that you don't know, and keep your doors locked. With that, I ask that you please, again, help us this weekend. Help yourselves, keep your family safe by complying with the stay-at-home orders and social distancing requirements, and have a happy and great Easter weekend. Thank you.
The first questions are for Dr. Grant Koufax. This question is from Gerald Chin of SF Bay. Related to an announcement made in Oakland today, will the city consider closing some residential streets off to traffic in order to provide more space to socially distance for residents who like to go out to walk, jog, and bike?
So I think it's very important that we keep physically distancing from each other per the shelter-in-place order. And while certainly we understand, and I want to encourage people to get out and exercise and get some fresh air, we want to also make sure that crowds do not congregate in areas, even outdoor areas. As we know, as the mayor said over the weekend, it's very, very important that people respect the order. And as of today, there are no plans in accordance to the question. Thank you.
Question from Lee Tan with NBC Bay Area. Can the Bay Area afford to send resources such as ventilators and doctors to other areas such as New York to help? We are doing well in comparison, but how quickly could we get resources back if we have a surge of cases?
Well, I certainly think if you've been watching the news, there's very high need in New York City right now. I can't speak for the institutions that are sending aid there, but certainly as a provider myself, I respect the need for that and the need to do that. And I certainly would also expect if the situation worsens here that we would be able to respond accordingly with the resources that we have here and potentially bringing back the resources to San Francisco. We still have resource needs here, just to emphasize. We have an ongoing need for testing supplies in order to increase our testing capacity. We have a great need for personal protective equipment to protect our healthcare workers and first responders. Those are dire shortages in San Francisco, across the Bay Area, across the country. So we need to ensure that we are meeting our local needs, as well as when we have the ability to help our colleagues who are struggling with the pandemic in certain regions across the country.
And another question from NBC Bay Area. Since the positive test at the Hamilton Family Shelter, are the rest of the guests and staff there being tested?
So our disease investigation team is assessing the situation and will make recommendations on any further testing necessary based on the exposure and the particular situation.
A question from Trisha Tondandi of the San Francisco Chronicle. Is the Department of Public Health tracking cases in single-room occupancy hotels?
So the cases that we know about in SROs are really through contact investigation. So that person is either tested positive or we find a case that was tested as a result of a contact of another case. So we will be recording those data and sharing those data if and when they are accurate.
And a follow-up to that, how is Department of Public Health handling any positive cases at SROs in terms of contact tracing and isolating vulnerable residents?
So we are aggressively contact tracing residents in SROs, and we are ensuring that if necessary, they are provided with hotel rooms to self-isolate and to protect themselves and their families and the rest of the members in that SRO.
A question from Janie Haar at the Associated Press. Are the 70 people who tested positive at MSC South connected to the 2 people who tested positive on Sunday?
Tested positive on Sunday I need a clarification. What 2 people are they
I
referring
believe
to?
what she is trying to ask is we announced at some point last week that the original 2 cases at MSC South are these cases related?
Yeah, I mean, I think it's likely, but I certainly can't say affirmatively about that those 2 cases are directly related to all the remaining cases that we've detected. The point is, from a public health perspective, when we assess the situation, when we looked at the patterns of engagement and interaction at the shelter, and as we tested more people, it became clear that the outbreak was widespread. And that's why we are testing everybody in the shelter, and made the decision to test everybody at the shelter at the time, as well as staff, to ensure that people knew their status, that we can monitor them, appropriately house them, and ensure that they get the best medical care possible, as well as taking aggressive steps to protect other people from potential infection.
And a follow-up to that question, which I hope I'm clarifying correctly. The 2 tests we previously talked about, we understand those folks were moved out of shelter. The remaining 68 guests, where are they now?
So again, it's a rapidly evolving situation, and as we talked about, the MSC shelter is now going to become a COVID-19 recovery center. So many of the people who are of the guests who tested positive at MSC South will be in that shelter, being taken care of by expert medical professionals, our excellent doctors, nurses, and social workers from the Department of Public Health, with support from the Department of Homelessness and Supportive Housing, as well as the Human Service Agency staff.
A question from John King of the San Francisco Chronicle. Will testing now be done on all of the residents in all shelters, given the numbers found at MSC South?
So we are, again, looking at the evidence and contact tracing cases in shelters, and we'll make a decision on how many people need to be tested depending specifically on the case, and really using science in terms of how best to contact trace, how best to test people when widespread testing is needed and when more limited testing is indicated.
And a follow-up to that question from Mr. King. Given the turnover at shelters from night to night, how are you finding people to test if they are no longer sleeping at the shelter?
So again, we are working with the experts on that shelter system, our colleagues at Department of Homelessness and Supportive Housing, our colleagues at the Human Services Agency. As you know, they run the shelters and the support systems for those shelters across the city. Along with our contact investigation teams, we are literally going through, when necessary, case by case, contact by contact, to make sure that we are doing everything we can to find people who are at high risk, to ensure people who are at high risk for bad outcomes are placed in hotels, and to ensure that people who have had a high-risk exposure for COVID-19 are receiving testing.
And the final question for you, Dr. Koufax, from Wilson Walker at KPIX. With the outbreak in the shelter, does that give you any added concern that you also have spread among the unsheltered population on the street as well?
Well, I think really, if you think about where we started when we started talking about this pandemic in February, I've always said that vulnerable populations were most potentially affected by coronavirus and would unfortunately suffer the greatest consequences, based on data from international data sources, China, Italy. We've seen what's happened, unfortunately, in New York. I'm very concerned when we talk about flattening the curve and when we talk about our current hospital capacity. I am very concerned about the spread of coronavirus in the population experiencing homelessness. Unfortunately, we know that this population suffers from great health disparities without a pandemic, higher rates of chronic respiratory diseases, higher flu rates, higher rates of hospitalization. Unfortunately, this pandemic will only put those inequities, those disparities in greater relief, which is why my department is working as hard as we can with key community partners, with our other key departments, to ensure that people are getting the testing they need, the care they need, and with HSA and with HSH, that people who are at greatest vulnerability for bad outcomes from this disease are placed in hotel rooms in order to protect them and to protect our community. Thank you.
Dr. Koufax, one final question from the San Francisco Examiner. Do we know how many of those 70 people testing positive at MSC have had underlying conditions or in the age range to be more vulnerable to COVID?
So I do not have those numbers yet, but certainly some of them have those chronic conditions, and we are looking through the numbers right now. And again, I want to emphasize that we are deploying our team of medical experts to ensure that people who have tested positive, whether or not they have a chronic condition, are getting the best care possible. And certainly, if in need of greater levels of care, they will be transferred to the appropriate medical facility.
Thank you, Dr. Koufax. The next questions are for Abigail Stewart-Kahn. I have a two-part question and a follow-up from Bihad Shaban of NBC Bay Area. Inside city shelters, are homeless people now being sheltered in a way that allows for safe social distancing? If shelters still need to be thinned out to achieve that, when do you expect that to be complete? Days, weeks, months?
Thank you, Behad. Just to clarify, so we are following guidance from the federal, state, and local authorities around creating 6 feet of physical distancing in our shelters. And as the journalist notes, this is very difficult to accomplish. Our shelters are very close and compact, and they vary significantly from site to site. We just know that puts these folks at more risk. We began implementing creative physical distancing at all of our sites several weeks ago, and I really want to thank all of our providers who found space where there was no space to make this possible even before we were able to start moving people out of sites. We are well on our way to reaching what I am calling shelter equilibrium, which involves moving the most vulnerable individuals out of congregate sites into hotels, and we should be able to accomplish that very shortly.
And a follow-up, what is the total amount the city has spent so far on hotel rooms for the homeless, and what is the range of the daily hotel room rates?
Thank you. So I will take this question on behalf of Director Rohr, who is the Director of Human Services Agency. And as we've articulated at past press conferences, under an emergency, Human Services Agency is responsible for mass care and shelter. So I'm happy to provide this response on behalf of the Human Services Agency. So the numbers that have been shared with me are that for the first 3 months of all of the hotels that have been brought online and under contract by the Human Services Agency is a total cost of approximately $35 million. Much of this is reimbursable by FEMA and other sources of information. And I think there was another question in there. I apologize.
I think that's it. There is a related question from Robert Campos of NBC Bay Area about those hotel rooms. What is the current number of leased rooms for unsheltered people, and how many have checked in?
Thank you, Robert. So I'll give all of the hotel numbers briefly because I think it's important to understand the scale and magnitude of this challenge. Again, these are numbers from the Human Services Agency, not from my department. The total rooms for all priority populations that are under contract right now is 1,892. Approximately 880 of these are for first responders, and approximately 1,012 of these are for vulnerable populations, as we've articulated in the past.
Thank you. And another question from Robert Campos of NBC Bay Area. I believe Dr. Koufax may have spoken to this, but to date, how many homeless people have tested positive with the coronavirus, and what is their condition?
Yes, thank you for that question and for your care for our unhoused neighbors. The Department of Public Health is not analyzing and separating their data in that way in particular. And so we may have we likely have other individuals who are experiencing homelessness and are also COVID positive that are at isolation and quarantine rooms. In fact, we know that the majority of people are either from SRO, sort of semi-congregate sites, or from shelters, or from the unsheltered population. What we know now is what we can speak to is who is positive in our shelter sites, and that is 1 at Division Circle, 1 at Hamilton, and the 70 that have been discussed today at MSC South.
Thank you. Question from Carrie Sisto of Hoodline. Is there an effort to move the unhoused residents off crowded sidewalks, especially in the Tenderloin, into public open spaces that are currently underutilized?
Yes, thank you for that. So immediately at the beginning of this pandemic, and I'll speak here on behalf of the Department of Emergency Management, which oversees our HSOC and unsheltered operations, but we are in deep partnership with them. So immediately at the beginning of this epidemic, we know that our unhoused neighbors are extremely vulnerable. And so all removals of tents, what people refer to as encampment resolutions were paused, and the entire HSOC operation went into a mode of educating and providing services. As things began to shut down, access to restrooms and food, it became the job of our HSOC partners, including our homeless outreach team and other outreach providers, to be the voice of education, knowledge, and linkage for people who are unsheltered and experiencing homelessness. We know that more people have become unsheltered because of our need to pause shelter intakes. This is a significant and important population for us. What we want to do critically and urgently is to move the vulnerable individuals experiencing unsheltered homelessness into hotels, and we will get to work on that, and we are working on that as we speak. And we are also working on continuing to remind people about social and physical distancing while unsheltered, and looking at and starting to explore possibilities for safe places to be. And we'll have more to share on that in the coming days.
And a final question from Kathy Novak of KCBS. You've talked about the groups of unsheltered people who will be prioritized when it comes to moving to hotel rooms. Will that change now, given the news of the outbreak? And will more people be quickly moved into hotel rooms?
Thank you, Kathy, for that question, which follows up on the previous question. We've said from the beginning that we're very concerned with individuals living in congregate settings, and of course, the most vulnerable among them and among the unsheltered population. We're talking about thousands of people. And if you include our SROs, we're talking about tens of thousands of people. And so this is a task. Moving into these individuals into shelters is a task that has never before faced our city in the scale and magnitude. So I want to use this opportunity to talk a little bit about what it takes to take on this massive undertaking. So first, the Human Services Agency has secured sites and rooms. You've heard about the scale that they've been able to reach there. For each site, the city and nonprofit staffing have to staff up immediately, visit the site, understand the site, staff enough people, everything from monitoring to security to medical to counselors to all of the supplies that need to be on site, thinking about meals and hygiene, thinking about things like accessibility for people in wheelchairs and with other accessibility concerns. We have to do a screening for vulnerability to understand who should be moving in when we aren't sure. We have to do an assessment of ability to self-care. And what that looks like is, of course, if you can't self-care, you're still going to come inside somewhere, but we need more care wrapped around you for that to be successful. We have to work on transportation, which has proven particularly challenging because of the physical and social distancing required. And so the buses have to be big with very few people in them. I've talked about meals and hygiene kits. We have to look at things like individuals with substance use issues, and we have to look to support people with mental health concerns in a harm reduction environment. And then we have to think about what comes after this. Where do people step down when they are able to step down to a lower level of care, and what do we do after we move through this pandemic? All of those things have to happen for every single site to come online, and so it's really a massive undertaking that has the city's entire focus now.
Thank you. That concludes our press conference.
Thank you.